Today we are going to deliver a lecture on topic vitamins and deficiency diseases. Let us start with definition of vitamin. The word vitamins comes from the term vital plus amines. Vital means life, amines means substance which are essential to life. Vitamins are chemically unrelated organic compounds required in the diet in small amounts to perform specific biological functions that cannot be synthesized in adequate quantities by humans and therefore must be supplied by the diet. Discovery of vitamins. In 1910, the first vitamin complex was isolated by Japanese scientist Umetaro Suzuki, who succeeded in extracting a water-soluble complex of micronutrient from rice bran and named it avaric acid. In 1912, Polish biochemist Casimir Funk isolated the same complex of micronutrient and proposed the complex be named vitamin. Vitamins are required to perform specific cellular functions. Many of water-soluble vitamins are precursor of coenzyme for the enzyme of intermediary metabolism. In contrast to the water-soluble vitamins, only vitamin K has a coenzyme function. Classification of vitamins. Based on solubility, vitamins can be categorized in fat-soluble vitamins and water-soluble vitamins. Vitamins, fat-soluble vitamins, vitamin A, also called as retinols, vitamin D, also called as calciferol, vitamin E, also called tocopherol, and vitamin K, also called phytoquinones. Water-soluble vitamins contains two categories: non-vita complex, in which example of this category vitamin C, and vita complex, vitamin B1, also called as thiamine, vitamin B2, also called as flavin, and vitamin B3, also called as niacin, and vitamin B5, pantothenic acid, and vitamin B6, pyridoxines, and vitamin B7, biotins, and vitamin B9, folic acid, and vitamin B12 called as cyanocobalamin. Properties of water-soluble vitamins. Water-soluble vitamins soluble in aqueous solutions, used as a cofactor by many enzymes. These vitamins are not stored in our body and excreted in urine. Functions of water-soluble vitamins. Vitamins B1 work as thiamine pyrophosphates and function of this vitamin decarboxylation. Vitamin B2 riboflavin. Coenzymes flavin adenine dinucleotide FAD and function as electron transfers. Vitamin B3 also called as niacin. Coenzyme of this vitamin nicotinamide adenine dinucleotide and function oxidation reductions. Vitamin B5 pantothenic acids, coenzyme A, function acetyl group transfers, and vitamin B6 pyridoxines, coenzyme of this enzyme, this vitamin pyridoxal phosphate, function is transamination. Vitamin B12 cobalamin, coenzyme methyl cobalamin, function methyl group transfer. Next, ascorbic acid, vitamin C, coenzyme vitamin C, function collagen synthesis and healing of wounds. Next, vitamin biotin, also called as vitamin B7, coenzyme biocytin and function is carboxylation. Next, folic acid, also called vitamin B9, coenzyme tetrahydrofolate, function as methyl group transfer. Fat-soluble vitamins are vitamin A, D, E and K, soluble in lipids but not in aqueous solutions, important in visions, bond formation, antioxidant and blood clotting, stored in the body. Fat-soluble vitamins. Vitamin A, formation of visual pigments, development of epithelial cells. Vitamin D, absorption of calcium and phosphate, deposition of calcium and phosphate in bone. Vitamin E, antioxidants, prevent oxidation of vitamin A and unsaturated fatty acids. Vitamin K, synthesis of prothrombin for blood clotting. Vitamins and deficiency disease. Vitamins A, also called as retinol, deficiency of this vitamin, loss of vision called night blindness. Vitamin B1 also called as thiamine, weak muscles and severe weight loss called as beriberi. Vitamin B2 also called as riboflavin, poor diet and mouth sores called as araboflavinosis. Vitamin B3 also called as niacin, diarrhea and dermatitis, plagra. Vitamin V5 pantothenic acid, ischemic attack and multiple sclerosis affect brain called as paresthesia. Vitamin B6 pyridoxines, low number or lack of red blood cells called as anemia. Vitamin B7 biotin, red and itchy skin, dermatitis. Vitamin B9 folic acid, immature RBCs in the bone marrow called as megaloblastic anemia. Vitamin B12 called as cyanocobalamin, abnormal absorption in the small intestine called as pernicious anemia. Vitamin C ascorbic acid, bleeding gums and swollen joints called as scurvy disease. Vitamin D calciferol, weakening of bone near joints called as rickets. Vitamin E tocopherols, faster depletion of RBCs from the body, hemolytic anemia. Vitamin K phyloquinone, irregular and slow blood bleeding and clotting, bleeding diathesis. Excess and lack of vitamins, fat soluble vitamins, excess of vitamin A, nausea, vomiting, headache, loss of appetite and low grade fever. Lack of vitamin A, dry skin, dry hair, blindness at night time and an increase in digestive infections. Excess of vitamin D, kidney damage, heart damage, nausea, vomiting, weight loss, muscles weakness, elevated level of calcium in the blood. Lack of vitamin D, softened bones in adult and bone deformities in children. Excess of vitamin E, dizziness or an upset stomach, fatigue and vomiting. Lack of vitamin E, premature deliveries, low birth weight, unhealthy fat absorption and nerve anomalies. Excess of vitamin K, liver damage. Lack of vitamin K, severe bleeding and easy bruising. Water soluble vitamins, excess of vitamin B1, energy production, eye health benefit and improve brain functions. Lack of vitamin B1, beriberi, muscle cramps and experience appetite loss, heart failure and water retentions. Excess of vitamin B2, migraine headache, antioxidants, anemia and itching. Lack of vitamin B2, visual problems and oral and nasal sores. Excess of vitamin B3, flush skin and liver damage. Lack of vitamin B3 contribute to damage to the skin and nervous system, diarrhea and oral sores. Excess of vitamin B6 damage nerves in the arms, legs, hand and feet and numbness. Lack of vitamin B6, anemia, itchy, scaly and patchy skin and convulsions. Excess of vitamin B9 help pregnant women prevent premature birth and neural tube defects in their babies. Lack of vitamin B9, loss of appetite, nausea, anemia, diarrhea, weakness, weight loss, malnutrition, headache, mood swing, insomnia, breathing difficulty, heart palpitation, paranoia and memory problems. Excess of vitamin B12 help in depression and production of red blood cells, but lack of vitamin B12, anemia and nerve damage. Excess of vitamin C, kidney stones and diarrhea. Lack of vitamin C, scurvy in adult along with muscles weakness, easy bruising and bleeding gums. Daily requirement of vitamins. Vitamin A, daily values in milligram. Vitamin A, retinols 1 to 3 milligram. Vitamin B1 30 to 200 mg. Vitamin B2 riboflavin 25 to 200 mg. Vitamin B3 niacin nicotinamide, daily requirement 30 to 100 mg. Vitamin B5 pantothenic acids 20 to 500 mg. Vitamin B6 pyridoxine 10 to 15 mg. Vitamin B12 cyanocobalamin 5 to 8 mg. Vitamin B7 biotin 300 to 5000 mg. Vitamin C ascorbic acid 2 to 12 gram. Vitamin D cholecalciferol 10 mg. Vitamin E tocopherol 400 to 2000 mg and vitamin K 8 mg. Thank you.